everyone, I'm Susie and I'm a dentist working at Triangle Dental. Today I'm going to take you through some aftercare instructions to try and ensure that your extraction site heals really nicely after you've had a tooth taken out. So first of all, removal of a tooth is essentially an operation. So we like you to have as much rest as possible for at least 24 hours after your extraction. So just take it easy. No hitting the gym, no hiking up mountains, and no 9 rounds of a boxing match, please. Anything that raises your blood pressure will cause you to bleed more and for longer. So just try and keep your blood pressure as low as you can for those 24 hours. So unless you've had sedation, you're absolutely fine to drive straight after your extraction and even go back to work providing you feel well enough, as long as your work doesn't involve anything too highly active. Because like I said before, it's going to raise your blood pressure, means you're going to bleed more, and that's not what we want. Ideally, go home, put your feet up and read a good book if you can.
Where the root of the tooth used to be, we want a good blood clot to form. Just as if you were to fall over and graze your knee and get a scab on your knee, a scab on your knee is a blood clot. Well, we want a blood clot to form in the tooth socket. Now, the blood clot that forms in the tooth socket is different. It looks different to one on the knee, and it's different because it heals much more quickly. But all of the advice that we're about to give you is all about looking after that blood clot so that it can heal quickly and efficiently. When it's all healed, it will form new gum and form new bone as well.
So the next bit of advice is try to avoid any vigorous mouth rinsing for the rest of the day. If you're going to take a drink, sip of water for example, try not to swish it around your mouth, because doing so will dislodge the precious blood clot, which is going to help the area to heal. Similarly, try not to spit. If you're going to take a mouthwash of any kind, try not to rinse anything out and spit, because the pressure from the spit will also cause you to lose that blood clot. It pulls it out and then you just continue to bleed, which is not what we want. You may wish to avoid any food and drink that's too hot, especially while you're still numb from the anaesthetic. We'd usually advise you at least wait for that numbness to wear off before you have anything, just in case you burn your lip or tongue or bite it accidentally, because that will be quite uncomfortable. A soft diet for the next few days is probably preferable, just to avoid aggravating that healing wound. So I'd avoid things like crisps and pork scratchings just for the next 48 hours or so. So the next bit of advice, guys, try and avoid alcohol for about 48 hours, simply because, again, alcohol is something that raises your blood pressure and that's going to cause you to bleed for longer, like we said previously. Also, if you're a smoker, I know it's difficult, but please try and hold off for as long as you possibly can, just so the toxins from the smoke don't infect your healing wound. So, keeping it clean. Now this is the aim of the game, guys, keeping your mouth as clean as you possibly can. So, brush the rest of your teeth as usual tonight. Just go really easy around the area of the healing socket. You'll know it'll be sore, it'll be uncomfortable to do. So just try and keep away from that, but keeping the rest of the teeth clean, and then your mouth essentially will overall be clean. When we brush our teeth, we spit, but we don't rinse. This is to keep the protective fluoride on our teeth. But just for tonight, try not to spit too excessively and too forcefully, simply because spitting will pull out that blood clot like I mentioned earlier. So instead, once you've finished brushing your teeth, try and just hang your head over the sink, over the basin, and let the excess toothpaste dribble out, rather than forcefully spitting it out. Starting the next day, what we like you to do is a warm, salty water mouthwash. Now this is simply a teaspoon of salt in a tumbler of warm water, not too hot that it's going to burn you, but just warm enough to dissolve the salt. And you're going to take a mouthful and rinse with it for about a minute, just bathing that area. Now we like you to do this 3 times a day, so think about it after breakfast, after lunch, after dinner, because what it does is draw out any debris and just help the area to heal really nicely. We want you to do that for about a week or so after, so 3 times a day for 1 week. But remember, don't do it any less than 24 hours after your extraction, because you may dislodge that precious blood clot that we want to keep in. If when you get home the area starts to bleed again, what you need to do is apply some steady pressure for about 20 minutes. So you'll notice we gave you a little pack with some gauze swabs in. What you need to do is open that, take out the gauze swabs, roll them into a little sausage and just slot it into the hole where that tooth was. Bite down and maintain pressure for about 20 minutes. Try and sit still, don't be up and moving about whilst you're doing this, and try not to keep taking it in and out to check, because that will start the 20 minutes all over again. Just keep it there for 20 minutes and then check. That should be enough to stop the bleeding. But if you do run out of the gauze swabs, a nice clean handkerchief will do the same job. Just make sure it's not a grubby one, because you don't want to introduce bacteria into your healing site.
After you've had your treatment, you might want to take some painkiller tablets so that you've got some extra pain control once the local anaesthetic has worn off. Sometimes people are absolutely fine without any pain-killing tablets and they have no problems after the local anaesthetic has worn off. So it is possible just to leave it and see how it goes for you. But to be on the safe side, I think it's probably a good idea to take some pain-killing tablets before the numbness has worn off. The best pain-killing tablets to take are paracetamol and ibuprofen. Now, paracetamol is a slightly more gentle painkiller, but you can have this any time of the day and around food or with food. The dosage that you can take with paracetamol is 2 500mg tablets up to 4 times a day. So that's a maximum of 4 grams of paracetamol in a 24-hour period. For ibuprofen, you're allowed to take 4 200mg tablets. So the most common dosage is that they come in 200mg tablets. You're allowed 4 of those 3 times a day. So that's a total of 800mg 3 times a day. Now, actually, on the ibuprofen packets, it often says you're allowed half that. Now, that is the old recommended dose. You may well want to start off with that, and having just 400mg 3 times a day is fine, and that's a more gentle dose, but we know that it's safe to take up to 800mg 3 times a day if you want to. Now with ibuprofen, we like you to have ibuprofen when you have meals, so it makes it nice and simple. If you're having 3 meals a day, have your meal and then have your ibuprofen tablets.
Remember to take all of your other medications as usual unless we or your GP or consultant have advised you otherwise. But ultimately, if you have any problems at all, please don't hesitate to get in contact. One of us will always be around and we're more than happy to help you always. Hope that was useful, guys. Just remember to keep it clean and rest up. We look forward to seeing you at your next checkup.